hold tight there. I'll get it. This is why you have a headache. Yeah, it's totally locked up there. We'll get it. Jesus, bud. Okay.
I get these headaches. I can tell it's in my neck because it's not like a headache that you would get from whatever, a hangover or what. It goes up through the back of my head, and they just happen whenever I'm working exercises or whatnot. And
You think worse in the morning, evenings? It usually get worse throughout the day, or
it's all day. It's just constantly there.
All right.
Yep.
All right, little sit up for me. Take a deep breath. Let it all go. Exhale. Deep breath. Exhale. Yeah, we gotta get those upper back moving. Okay. Have you scoot down on your side. All right, take a deep breath in for me. Look over this shoulder. Try to relax. Exhale. Nice. Other side for me. Take a deep breath in. Exhale. There we go. Good. Face up for me. Good. Feel. Right side. The left shoulder is a little bit elevated, which is really a left head tilt. So essentially you're trying to get away from this right side. When we tilt our head left, the bones all shift to the right. All right, really easy here. I got you, bud. I got you. Relax your head and I got you. Oh boy, yeah. I got it. Yeah, hold tight there. I'll get it. Okay. I want to see how it moves before I massage it. I want to see how. This is why you have a headache. Yeah, it's totally locked up there. We'll get it. Boy, tell me about your day usually, in terms of work and life, and give me your...
I'm a firefighter, but other than that, I have take care of 3 houses, yard work, trees, also anything and everything that has to do with that. And,
that's right, all the gear that you put on for...
Yeah, all the gear.
Okay.
And then I'm a skateboarder, I surf for my hobbies, and just...
I got you pretty active, yeah.
Yep.
Man, when did you start skateboarding? What age?
Well, I started as a kid, and then took a good hiatus, and then started up again at 27.
It's impressive,
And built a ramp in my backyard.
Oh, really?
Yep.
My cousins had that up in Maryland. They had this giant half pipe.
Yep, that's what
there.
it is.
Yeah. I'm like, man, I can barely even stay on the board. I'm like, gee.
I use a massage gun too.
It ain't gonna bust this. That's cute. When it gets this knotted up,
Time to come see you.
Right, it's like using an air freshener to try to clean your bathroom. Like, okay, that's cute. That's nice. You've been a firefighter for how long?
24 years, plus a couple of years of volunteering, so almost done.
That's cool. Yeah, it's like a guarded state. Your muscles are, we would say, just always ready for something, because of injuries and right. It's like the tension just never subsides. It just lingers in here, and that's part of what builds up a constant high level of lactic acid, right? So the muscles are like the idle screw on the engine's turned up too high, and all this exhaust is coming out, and that exhaust is lactic acid, and then the nerves sit in that lactic acid, and it can make it so that even when you're laying down, even when you're just taking it easy, you're still all sore and inflamed. It's like the body has a muscle memory. The muscles try to protect things. It's not their job to protect things, but when the more important structures get injured, the muscles come to the aid of those structures and get tight. The stability should come from your mobility, the alignment and mobility of your spine is what matters. So the curve in your neck and all the vertebrae working as a team. There you go. Way too much resistance to having your head drop back.
Yeah, I always feel bad when I come in and
Overflowing.
have to make you have to work extra hard because I'm.
Let's get it. No Nobody else gonna do it. Nobody else wants to. Too much. It's too easy to just inject something. Let's give you a nerve block. Let's do a nerve ablation. Let's hook up the nerves to electrodes and fry the nerves. Like what? I can't wrap my head around that. That's actually a legitimate treatment that's done. like taking your car in for service, and then the tech comes to you and goes, "Okay, what we're going to do is we're going to hook up electrodes to your check engine light. And we're gonna just fry the engine light bulb. So that bulb that says check engine light, we'll just blow it up." What? But isn't that light bulb just indicating something else is wrong? The light bulb's not the problem, is it? Yeah, but it's so annoying to drive around with that check engine light on. So that's the best idea we've come up with. What are we talking about here, people? I'm the loony bin? I'm not the doctor? That's doctoring? Okay, I guess I don't want to be a doctor. If that's what doctoring is, then no thank you. Not dealing with the real problem, covering up the what's going on, and not dealing with what's really happening.
Yep. I was wearing my helmet yesterday for, 3 hours.
Uh-huh.
So it's probably extra mad today.
Oh, man. End of the day. Have we talked about a Deneral pillow? Have I ever mentioned that before? No.
I might have them.
The
pillow.
The pillow? Do you have that?
No.
Okay, we'll talk about that in a little bit.
Cool.
There's the Deneral device, the orthotic that we're stretching with, and then they make a pillow that. What pillow do you currently use?
It has a curvature on the top of it, but I don't know the name of it.
Okay, well.
It has a like indent on the top or whatever.
Okay.
It's not just a.
I'll just show you the Deneral pillow, and like I said, the mindset is that we need to be holding your neck, ideally when you're sleeping, supported in a curved position, and whatever device works the best at that. The Deneral pillow I find to be pretty good, and so I'll let you compare it to what you're using.
Cool.
But it's really just trying to emulate this. What's the intent and purpose? Well, just holding your neck, not letting it just flatten to the pillow to the bed. You
Gotcha.
want it, supported.
What about side sleeping and then whatnot?
Right.
I mean, it's can't kind of control.
If it's on your side, then then you just do whatever. But
gotcha.
The goal is to have your spine healthy enough that we don't feel the urge to run away from our back to our side or to our stomach.
Okay.
Usually those are avoidance positions because our back isn't comfortable because there's all this inflammation back here. Yeah, like right here. Yeah, right there. Whew. So the marks are evidence of, I think I've already taught you this, but for people watching, this is the lactic acid. Because these muscles are running all the time, they're essentially producing all this exhaust. Oxygen binds to it, converts it to carbon dioxide and water. But because it's so stiff, the oxygen from our blood has a hard time getting pushed uphill to these really tight, restricted areas. And so the acidity essentially remains unbound until we force blood uphill into these tight regions. And there's a lot more on the right side than the left here. It's all kind of really dark right there.
Can I use one of those things?
Absolutely. Get a gua sha tool, get some oil or cream, or do it in the shower, and you just kind of, maybe 30 seconds, 1 minute a day, just kind of just comb.
Really?
And should drastically remove the amount of inflammation at your neck.
Wash out.
It's called gua sha, so GUASHA. I'll write it down for you, but it's
Right.
They make all different types of instruments, but just blood flow. Ultimately, the more curve that's in your neck, and if the vertebrae are moving properly, we really shouldn't have to gua sha. I use this as a means to help unlock your spine, so that the stretching works well and the adjustments, can actually function. Because if your neck is all jammed up and stiff, then I can't even adjust you, and we have to go back to PP Blaster and WD-40 and try to loosen up these threads here a little bit because they're all jammed up. And go. There you go. Yeah. There it is. Nice. Clunk.
Right.
Jesus, bud. Okay.
It wouldn't be any fun if somebody was easy, would it?
Reminds me, my wife had a Tahoe and it needed the windshield wiper reservoir started leaking, and on this 2003 Tahoe they put it underneath the battery. And so as I'm taking it apart myself, I can do this myself, I don't need to take it to the mechanic shop. I find the reason for why the windshield wiper bottle was broken was that the previous owner must have had a battery leak all over the plastic,
Yeah.
and that's what cracked it and all that anyway. And so all the bolts at the bottom of the tray are completely disintegrated. They're like, there's no heads on the bolts. They're all just,
Yep.
the metal's all destroyed. I'm like, okay, now this is past my skill level. I can't get these bolts out, right? And they take it, they drill them out. You know,
Oh, yeah.
the mechanic shop drilled them out and got the. You know, I was like, okay, this is past my. Put the hand back on that. Like, there we go. Just gonna lift your chin up for me. Just let stretch a little bit. Stretch this. It's like you do 1,000 push-ups a day or something.
Who knows? I used, again, like the massage gun on that in that area too. So you act like I don't do anything. I try.
I tried so hard. Doesn't even matter. Right there on the front part of your shoulder, boy. Oh man. That's a good stretcher.
Pick up a lot of people.
Yes.
Yeah. They call it the 3 T's in chiropractic: thoughts, traumas, toxins, right? So traumas, injuries, and falls; toxins, the lactic acid and alcohol, you know, and then thoughts, your mind, stress, you know. And so, you know, I used to think everything was like traumas and toxins, and then the more I've practiced, the more I've realized that, you know, how vast and influential the mind and the thoughts component affects our health. Yeah, put that arm back. There you go.
How would you suggest loosening up that?
This is where you're on your back on those, either the roller, the den roll, you know, the back one, and then you have your arms to the side or above your head.
Okay.
And we got to stretch our shoulders back every day. There's the neck guy separately, and then there's the back guy. It's the forward rotation that does this. It's just the pec is a dominant upper body muscle up here, and so it pulls the shoulder forward, and rhomboids, all that pull the shoulder back, and this muscle in the front is winning that war. It's winning that battle, and so it's trying to lengthen this out a little bit.
I feel relaxed.
You say so. I can't imagine trying to work on you feeling tense. How we doing in here? Okay.
Yeah.
No pain or no?
No.
Okay, good.
I have been having pain in my middle finger.
Okay.
And not from like a jam. It's been months with that too.
Tingly or burning or numb or just what
Um,
kind of pain would you describe?
Feels like I need to pop it.
Okay.
And I can't.
Just the joint. This is the joint here. Maybe. Probably just working hard. You've injured that guy pretty good before. Gee whiz, skateboarding?
That
Look at the knob.
that was from construction work.
Look at the knob on that.
That was like February.
Jeez. Yeah, I got through there, but gee whiz, that's been. Wow, you've really busted that guy. Okay. Okay, more normal. And you've jammed this guy too. This is the one bothering you right here.
Yeah.
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 Right here.
It kept feeling it in my. It's like on both sides of the knuckle.
More here
Yeah.
than here. Okay.
Yeah.
All right.
Did it pop?
Yeah.
Yeah, it just popped, which was pretty good.
You ever feel like your fingers get stuck in a fist? You have to open them up. They ever get stuck? No?
No.
Okay, good. It's called trigger finger sometimes, though. I want to keep this area. There's a bunch of tendons, and they're wrapped in like a zip tie, a sheath right here. And if the tendons get dried out, they kind of catch on each other. And that's what. So right in here, keeping this from getting too crunchy and built up. Yeah, normal. How we doing in here? How we doing on this, guys? How's that guy?
Good. All good.
Okay, good.
I think you fixed my finger. Dang it. Come in here a long time ago to get.
Job to walk on you. My wife did that all the time years ago. Her foot was bothering her the other day, and so we were watching a movie. She just kind of put it on my lap. I was like, I started working on it while I watched, and she gets up to go get something. She's like, "Ed, my foot feels all better." I was like, "It's a miracle. It's finally happened." I found somebody.
Any suggestions on what to do for yourself?
Just take them. Just try to do what I did here. Just try no bending or twisting. Just a straight pull.
Okay.
Kind of, try to, and then if you can find the spot. Jeez. Just try to find the spot. That's, you try to dig and find. So if you find a spot in there that's hurting. You understand? You kind of just find where it is and then just work it.
Gotcha.
Right? You just. Like on that pinky, I would sit here. Oh my gosh! Oh my gosh! Look at that! It's like twice the size of this.
And like I said, it's been since like February.
This guy?
Yeah.
What'd you do? Punched a wall or something?
No, I was just doing just basic construction stuff.
Jammed it.
Yeah, and I really kind of don't know exactly what I did.
All right. Well, we got to start compressing it. I would just. Start mashing that.
Really?
Yes, sir. It'll keep growing on you. If you don't, it's called a Heberden node, we call it, but it's just, The acidity attracts calcium. So acids are negatively charged and calcium is positively charged. And so what happens is if you leave this acidity and pain in here a long time, it'll keep on sucking calcium out of your blood and depositing it as a bone spur. That's what you have on here.
I thought it was just going to heal on its own.
That would not give me a job, okay? It'll heal stiffer. So when we have, it's really an injury that your body then is going to beef up the joint, making it stronger, but then you're going to lose range of motion. The range of motion is what actually helps to lubricate things. So then it starts to get stuck. It'll become like, and I have to pry my finger open. It's getting stuck, bent.
Gotcha.
Is really what, or your range of motion will be decreased. Your body will stabilize it by stiffening it, which then makes you lose function and mobility, but it does make it stronger. So it's a trade-off. It's not a disease process. This is not a disease. This is an adaptation. Your body's saying, let's make the joint bigger to handle the. I guess this guy's gonna keep doing construction and keep damaging me, so we got to get bigger in size.
Yeah.
Wow, the power, man. Nobody should ever tell you that your core is weak. Your core is plenty strong. It's lost suppleness. is that, Ed? No, not the butt. Anything but there. The importance of this joint, called the sacroiliac joint, moving is vital for the health of lumbar 5. So the guy right above that has all the surgery, or predominantly all surgery happens at the last 2 vertebrae in the lower back. A large reason for that is this joint, when we sit too much or even just standing, not moving, locked in one position, this joint becomes totally frozen, and then the joint above L5 does all the work. So keeping this joint flexible is vital. That's primarily what we're doing when we're on our side. When I twisted you, we're trying to loosen up this sacroiliac joint. That's why we do that adjustment. Breathe. Relax your chest. Good. All right, good. Arms down. Got it. Okay, good. All right. All right. Press back with your elbow into my elbow. Press back. There you go. Yep, got it. Go ahead and tilt your head left for me. Tilt left. Go ahead and tilt your head left.
I didn't know you could do that.
Go ahead and tilt your head right. Okay. Tilt right. Yeah, nice. There's a mini version right here. In the pillow, there's a zipper, and you can open this up, and eventually this goes into the pillow, right? Where they make a firmer one than this, and there's a hole in the pillow that your head can drop into, and we actually try to see if how long we can stay on your back. So we're gonna first try it on your back here for me. I'll let you feel this head here. Yeah. There you go. Back. Yeah, and then this is where we really want to hang out, is beyond our back, and 45 to 45 each way is where we're trying to, try to live. You understand? 45 to 45 if you want to have your head turned a little bit, but just not having it at full lockout while we're sleeping, ideally. If we can somewhere between 45 and 45. When we rotate our head past 45, the neck pulls straight, so that curve that we're trying so hard to put back in your neck, if you have your head turned all the way, there's no chance of there being a curve. Make sense?
Yep.
And the same thing happens with our head tilted. When we tilt our head as far as it can go, the curve that's in your neck, again, has to be pulled straight. So anytime we're sleeping with our head turned too far, tilted too far, you're taking whatever curve you might have and taking it out. And so we're trying to reestablish that curve. Lift up a little bit, and then get the idea. And there's a hole now in the middle of the pillow that lets your head, if you want to stretch a little bit, and you can, maybe start sleeping like this, you wake up, and you're, if it's too much, then you put the flap back in, and then it reduces the depth of the stretch.
Gotcha.
And this is
pretty comfortable.
Yeah,
actually.
Yeah, this is where I hang out here, just
cool
on a general pillow. And then eventually, like I said, this is 20 minutes a day, and the goal being that your neck, that this can go into your pillow, and then you don't necessarily need to do this on the floor anymore, and you really just do your back one. And then this and the pillow, Captain Planet, our powers combined.
Cool. All right.
This guy, you put the books behind you if you need to help you. There you go, lay back for me, I got you, but there you go. Yeah, and you put some block behind you to help make the time. And the same thing, you asked me about the shoulders earlier. You're trying to bring your arms eventually up, knees bent. Knees bent for me. Your knees. There you go, and then your arms above your head like this.
Gotcha.
Right, and you're working on, now if your hands go tingly or numb, you can, move them to the side or put them down. That makes sense, but we're trying to stretch the pecs. Stretch all this open.
Gotcha.
Just like that, yep. And then you just relax your arms and go to sleep and try to see how long you can have your arms above your head or to the side. And that'll bring the shoulders back and stretch the pectoralis. All right.
Thank you,
Awesome,
sir.
buddy. God bless you. Awesome.
Awesome. I feel